If you have any questions about your benefits today, beyond today, so your health insurance, your life insurance, your dental insurance, your flexible spending plan, we have a new vision plan we're going to talk about today. We want to be sure to be the filter for your questions. So we have inside your packets of information, the folders, you will see we have business cards. You'll see Linda's in there. You'll see Jane's in there. We have 2 people assigned to your organization to make sure that you folks are taken care of. Some of you have called us. I see some smiles on your face. You know how good a service we provide, so I get to brag for a second at least today. So make sure you call our toll-free number. We're open from 8 to 5 p.m. Central Standard Time. You all have packets in front of you, so we're going to go ahead and get started. I have a lot to talk about here today. We're going to go through a comprehensive discussion and review of your benefits. So on the right-hand side, you will see we have a PowerPoint presentation. Again, it's on the right-hand side. It looks just like this. We're going to go through sheet by sheet. Some of it will be faster than others, but we want to make sure we're going to give you a thorough background on the benefits and your offerings for 2017. So the agenda is as follows. We will talk about your medical and prescription drug program. Quick question with the audience. Does anyone know who your insurance carrier is for your health insurance? All right? Marshall County, right? Trick question, but you look at your ID card in your wallet and you say, yep, it's Blue Cross Blue Shield. They are the administrator, but the county is the insurance company at the end of the day. So you've determined the rates of your health plan by your good usage, which you've done a great job on. Your wellness plan is second to none. Okay, we'll also talk about your dental plan, which is also self-funded, but it's administered by Delta Dental. The new vision plan, your group life, accidental deaths and dismemberment, your disability insurance, your voluntary employee life insurance, so that's what you'd pay for out of your own pocket, your voluntary dependent life insurance, your flexible spending accounts. I'm going to just touch on that very briefly because your enrollment's in December for your January 1 on that. You have an EAP, also known as Employee Assistance Program. Certainly want to hear your questions and then what happens next, and I'll show you some links as well. Okay, let's start with the medical plan. Staying with Wellmark Blue Cross Blue Shield for the administration, not changing the network. You have 2 health plans, right? You have an embedded wellness program that's worked very effectively, so congratulations to all of you. I think this has helped keep your costs down. This is the 3rd year of doing this program. So you, and if you are covering a spouse, are required to get an annual physical examination in order to keep the wellness option for yourself, right? Again, you guys have done a great job. 99% of you have followed the request of the county to help contain cost and have provided your wellness exams, okay? So that means that you're doing better than the national average, which is about 75% participate in wellness when they're offered. So if you get your checkup, you get to have the wellness option. Now, I'm going to be very brief as I can on the wellness option. So if you take a look on the sheet 4, you'll see that there's 3 columns on there, right? Do you see where it says out of network? I don't want to spend any time on that. Just keep in mind if you go to a non-network provider, that it's going to be a higher deductible and higher out-of-pocket expense. In Iowa, you have 100% of the hospitals and 100% of the physicians in the network. So it's really not a worry for you. If you have an emergency and you're traveling outside the state of Iowa, your plan requires that you're going to receive benefits as though it occurred in Iowa. So you have that peace of mind. Children are going to be covered through the Blue Card PPO program, Mayo Clinic, Baylor University, Johns Hopkins University. They're all considered in-network. So that's why I don't want to spend time on the non-network. It just is very hard for us to end up there. So the in-network benefits are not changing for 2017. So your day-to-day services, you're not feeling well services, right? You go to your doctor, you go to your primary care, or you go to a specialist, you're just going to pay $25. That's not a change. Okay? So day-to-day services, $25. Your checkups, how much are they? Can anyone tell me? They're 0. They're covered at 100%. So that's part of the incentive of your wellness plan. So where you see that your physical, your annual exam, that's correct. So your well woman exam, well baby exams, and your checkups. So everyone sees the deductible level and the coinsurance and the out-of-pocket. Those tiers are really related to major medical events. An inpatient, outpatient, MRI, a CT scan, a major event that occurs medically. That is where your deductible will apply. You as an individual will not pay more than $500 per calendar year. Even though your renewal is July 1, remember that your plan works on a calendar year, so you'll pay the first $500 as an individual. After you pay the first $500 of your deductible, your plan is co-insuring. So you are co-insuring with the county. You'll pay 20%, the county will pick up 80. That's why it says 80-20 there. You'll pay 20% of the remaining charges up until no more than $1,250 comes out of your pocket for a major medical event. You're capped. If you have a family, your deductible's $1,500. Does everyone see that? But keep in mind, your deductible is embedded. So if you're just covering a spouse, then you have a $500 deductible. Your spouse in that example would have a $500 deductible. The point I'm getting at is your deductible will not exceed more than $500 per person per year. Yes, you could get to 3 deductibles or $1,500 with 3 belly buttons in your family, but no more than that amount for your deductible. It's always per person. Okay? Your out-of-pocket for your family is $2,500. Your lifetime maximum is unlimited. Folks, when I started with you, it was $500,000, right? Some of you remember. Then we moved it to $1 million. We thought that was responsible. Then we moved it to $2 million. We thought that was responsible. Now, and then it went to $5 million, and now it's unlimited. It's very important to know this. There are claims out there that we're seeing. We have a claimant at a group of $3 million right now. So in the old days, you would have ran out of benefit, and that's why we're seeing big increases in healthcare these days. It's on TV. It's in our face all the time, right? The problem is that these large are now boomeranging back into health plans, whereas in the old days, people ran out of benefit. They became an indigent patient with the state, and now the insurance companies, which is all of us here, are having to pick up for those. That's part of the reason why we're seeing the increase. So the peace of mind here, the good news is you have an unlimited lifetime maximum. So we're going to go to slide 5, continue on the wellness. And these are things I've talked about already. So your preventative services, annual exams are free. Your inpatient, outpatient, your emergency room. The emergency room is 9 times more expensive than the doctor's office. Please use good common sense, and if you can wait out till Monday to go to the doctor's office, do so. You have an urgent care center in Marshalltown, as you know. You pay a copay for that service. So just my advice, if you can, stay away from the emergency room unless it's an emergency, okay? But that's a major medical event requiring your deductible and out-of-pocket. So no changes on the medical plan, as I mentioned. I like to do a little educational background on these things just to give you a reminder of how your plan works. So we're going to talk about your drug card now. No changes there, same pharmacies, same great plan. If you see at the top, it says out-of-pocket maximum. So you have a separate out-of-pocket maximum on your prescription plan than you do your medical plan. They happen to be identical. It is very unlikely that you're going to pay enough copays to pay $1,250 out of your pocket throughout the year. But it's out there just in case. So it's a stopgap if you have a huge medical event. Your drug card is as follows. So your generic drugs at the retail level, you pay $10. If you go to a brand name drug, it's going to be $40. The ones we see on TV every night, right? And that includes specialty, and that's very important to note because on the street, if you bought a street product from Walmart or any insurance company, the consumers are having to pay 50% of their drug costs for a specialty drug in these day and ages, which is really hurting plans and people I would contend are underinsured. So your plan is second to none, and don't get me wrong, you deserve to have it, but this is a plan that's been in place for several years, so you have the luxury of having a plan that is just not available, okay? I did put in oral chemotherapy. Medications are $0 because they're going to be covered under your medical plan. Is anyone using the mail order program? Okay, something to consider. You can get a prescription from your physician, 90-day supply, 3 refills. They're shipped to your front door. You don't pay any shipping. Tamper-proof packaging. The benefit to you is you pay 2 copays for every 90-day supply. That means you'll get a quarter of the year at no charge. So blood pressure medications, cholesterol lowering medications, asthma medications, thyroid medications, you save a quarter of the year. So my job, believe it or not, is for me to help you pay yourself, not shiny buildings. So if you have the opportunity to save the county money and yourself money, use the mail order. It's simple. You can use your Flex card. You can download the forms off of your website that you have, your intranet. We built you your own specialized website, so the mail order forms are out there. So if you're taking a brand name drug, what I'm telling you here is, if it's shipped to your front door, you'll save $120 a year. That's pretty powerful. That's a lot of money that you can do other things with, right? All right, we're going to continue on here. We're going to go to page 7, and this is where I get to go a little faster. Okay. So slide 7, just a reminder how your wellness exam works. You want to make sure you turn in all your exam information by the 31st of December. Jane does have a checklist of all the people that have turned in their forms so far this year, so if you want to see us afterwards, we can look that up for you. And also how it's going to work in 2018. So starting July 1, you will want to get your exam on the books and make your appointment and to get it done before the next May 31st deadline. So you'll want to turn that in. Below there on slide 8 is just the wellness, the non-wellness plan. So we talked about the wellness plan. If you don't get your checkup, then this is what this plan looks like. I'm not going to spend any time on this, but basically your office visit copays double, your deductibles and out-of-pocket maximums double, and your prescription drug costs double as well. So it's really an effective plan because at the end of the day, the cost for your medical insurance, whether you're on the wellness or the non-wellness plan, is the same. And so the incentive for you is to say, I'll just get my checkup and I'll pay the same rates as someone that is either on the wellness or on the non-wellness plan. So it's a matter of if you don't want to do it, that's fine. You'll just have to pay more out-of-pocket exposure on the plan itself. So that's on slide 9, and that's also on slide 10. And voila, we're going to go right into the dental plan. And since one of my hands is tied up here, I'm going to again draw your attention to looking at the slide 11. We're staying with Delta Dental in 2017. We're going to make some changes, though, some enhancements, actually. So you see the 3 columns. I have the benefit itself, and then you'll see this column that says Delta Dental PPO. So we're introducing a PPO this year. The far right-hand column on slide 11 is where you're at today. We're not changing your plan, folks. We're enhancing it. So you may be the benefactor of the PPO level discounts and enhanced benefits if your dentist is in the network. So what I've done, or Jane has, she has put together a list of the dental providers that are in Marshalltown that are in the PPO. So I'm just going to name off a few for you very quickly. So for example, Andrew Chan, Mike or Chad Meneke, Michelle Johnson, Eric Christensen, Daniel McEnroy, Paul O'Kane. Does anyone want to name another one for me I can look up? Is not in the PPO. John Collison. Is that with a C? I don't even see a John Collison on here.
Is he in Marshalltown?
Yes. He is he's in there. He's on the first one. He is not a PPO provider. He's not. Not. Okay? So the message here is not. So the message here is you're no worse off than you are today. Okay? If you're lucky enough to hit the dental lottery, then you're going to get a better discount. Okay? So you can if you want. It's up to you. You know, people have it's a personal thing for them, dentists, obviously, just like their doctors. So we're not telling you to do that. We're just saying if you like, you can change, or if you're happy with where you're at, we're not going to put you in a worse position. Okay? So on the PPO level, your deductible is obviously less. Okay, keep in mind your checkups are the same under both levels. So if you get your checkup, don't worry about it. You're still going to have those covered at 100% on both tiers. The benefit comes into play really at the beginning of where your routine and restorative. So that'd be a cavity repair, cracked tooth, chipped tooth, that type of thing. You'll pay the first $15 as opposed to $25 where you're at today. And up to 3 deductibles in the family are $45. Okay, so it's per person, just like your medical plan. And on the routine restorative, you pay 10% coinsurance versus 20% on the PPO level. Okay, the other benefits are really identical, going all the way down. The difference is going to be your deductible. Okay, so there's your incentives, really the deductible for those levels of service. Please keep in mind where it says calendar year benefit. That is not a benefit at each tier. That's your total. That's a blended number. So we're not changing that. It's $1,000 per belly button per year of benefit that is paid out total for the Delta Dental. Unlike the medical where I said it's unlimited, right? It's a limited benefit on dental. So keep that in mind. Your orthodontia is for children through age 18, so up to age 19. It's $1,000 lifetime benefit. Okay? So it's not something that you're going to have every single year like you have for your endodontics, your periodontics, your cracked teeth, your onlays, those types of things. That's $1,000, right? All right, so bear with me. So what we're going to do this year is working with the Wellness Committee. There's been some talk about how can we enhance the dental. So starting July 1, it's your new plan year for your dental. If you leave any money on the table that you didn't use out of your $1,000 allotment, so let's say you had a $500 cavity charge in August of 2017, and next year, come renewal, you didn't spend the rest of that money. You have $500 that today you would have left on the table, right? What I'm telling you is we're going to go ahead and give you a to-go benefit. So in that example, you will have an additional $500 to spend for next year. So your $1,000 becomes $1,500. And you can leave that money on the table year in and year out until you reach a point where it'll cap out at $2,000. So you could theoretically double your benefit with the money you don't leave on the table, or that you leave on the table. Okay? I've given you examples on slide 12 of that. It's very self-explanatory. And by the way, that's for each person you cover. So if you have a family plan, that applies to each of those persons separately. It's a very nice benefit. A very nice enhancement indeed. Okay? So far, so fuzzy? We're all right. Okay. We get to roll right into the voluntary vision plan. Very excited about this. We implemented this actually at the city a couple years ago. It's gone over very well. I've also prepared a list of the providers. This is easy because I just did Marshalltown. So the vision providers that are considered in network are Eye Care Associates, McFarland Eye Center, the Optical Center, Walmart Vision Center. Wolf Clinic is not considered a network provider, but there is benefits for non-network providers. So I'm going to turn your attention to slide 13. So Visus is the network, and I will provide you links at the end of the discussion where you can look up providers if you'd like. So I have the details of the benefits column. I have the in-networks benefit where I want to spend my time. Just keep in mind you get an allowance for non-network. Okay, so you'd have to manually turn in your claim to get those dollars back. So let's talk about the in-network. So your frequency for examinations is once every 12 months. And they do count every 12 months. So at 11 months and 18 days, you go in for another vision exam, it will not be covered. It has to be at least 12 months or more from the last exam. Network level, you pay $10. There's no deductible. For single vision, bifocal, trifocal, lenticular lenses, and polycarbonate for the children, it's just a $15 copay. People asked about transition lenses. I wear transition lenses. You're going to get a heck of a discount on the lenses to begin with, as well as those transition lenses, but it's not going to be just a $15 copay. Okay? You'll get a great discount, but you'll have I can't tell you what that would be because every vision provider is different. Okay? But for standard lenses, you just pay $15. Your frequency for the frames is once every I didn't get in the frequency for the lenses. My apologies. It's once every 12 months for the lenses. For the frames, it's once every 2 years. If you went through a wholesaler, I doubt you're going to. You're most likely going to go to a local provider for your frames. It's once every 24 months, like I said. It's a $150 allowance, basically. Okay, so if it's a $300 frame, you pay $150. Is what I'm telling you. Okay. Contact lenses, you can do one or both in the same year. However, only you're going to have to choose which one you want to have covered. Okay. So what people are doing is obviously they're going to either get their contact lenses or they're going to get their lenses covered once a year. On the contacts, it's a $130 allowance. Okay. You can't get both in the same year covered, is what I'm trying to tell you. That's the simplest way. Okay. So this is a voluntary benefit. If you want it, you want it. If you don't, then it's absolutely your decision. Okay. I'll have more details in your packets, but I wanted to just hit on the highlights for you. If you go to a non-network provider, obviously you see the allowances that you're going to have provided back to you after you pay your bill. You turn in your claim. Also, just keep in mind you have network providers across the state. I only provided you what we had in Marshalltown just to make it simple today. All right? Any questions on the vision? LASIK insurance, or LASIK surgery. Thank you. It is covered with a discount, and depending on the center you do it at, they do promotional situations, 10 to 20% off. Okay. Good question. Other questions? Great. All right. So I'm going to go through your ancillary benefits. That's what we call them anyway. Your life insurance. You're all provided a basic life insurance policy at no cost to you. So what I need you to do is determine which department you're in, and you can find the level of benefit that you receive. Pretty self-explanatory. If your loss of life is due to an accident and you're on the basic life insurance policy, then your beneficiary receives double the amount that you're eligible for. So if you're in the county assessor's office, now let me see here. If I'm in the, county assessors, it's $40,000. If my loss of life is due to an accident, my beneficiary receives $80,000. If there's a dismemberment, God forbid, right? You lose a hand or a foot, then you would receive 50% of your benefits. So we have the schedule of benefits out on your internet. I just want to give you a couple examples. There is an age reduction schedule on your life insurance. So at age 65, it goes down by 33%, and then down to 34% at age 70 of your benefit, just to let you know. Most people are retired by that time, but I wanted to point that out. In addition to your group life insurance that's provided to you at no cost, Marshall County also provides you a long-term disability policy. This is a phenomenal benefit. So if you're disabled beyond 180 days, on the 181st day forward, you'll receive 60 cents on the dollar of your paycheck until you reach normal retirement age, if you're disabled. Okay, my normal retirement age is age 67. This young man in the corner is probably age 85. Just kidding you, sir. But point being is your policy is modernized to follow what happens if they do change the Social Security age, okay? So the way this works is you can get up to $5,000 a month. That's monthly. So if I'm making $2,000 a month, I get $1,300. So it's an income replacement plan. People always think, when I talk about disability, that they believe anyway, that Social Security will take care of them. I don't know if you've ever seen what people go through to get a Social Security disability situation covered. It's very difficult, okay? So this is a policy that provides you income replacement. Now, if you do qualify for Social Security, you can't collect on both. Well, you could, but you're going to offset one another. So if you're getting $1,000 from your disability and $1,000 or $500 from your Social Security, what will happen is they'll reduce your benefit down to $500 in that example. You can't collect on both, so they're fully offsetting. Okay, So most times people are going to get a benefit. And if they fully cancel out, you'll get at least $100 a month on your disability. Okay? You're not paying for this benefit, so something's better than nothing if that were to occur. It's not likely, but just to let you know. So again, 180 days is the elimination period. On the 181st day, you receive your disability from Sun Life. Now, there's a 2-year own occupation definition which says if you are unable to perform the material duties of your occupation for which you're trained and educated for in the first 2 years, you're disabled. If, however, you're able to go back to work on some other vocation, you open up a stained glass company in 2 years. You're like, hey, I can't be an auditor anymore, but I can do stained glass. Just bear with me. At that point in time, Sun Life says, well, you're no longer eligible for disability benefits. They say, let's do an income formula to see how much you've lost in your pre-disability earnings, because they want to get you back to work and they want to give you an incentive. So I'll give you a case in point. If you were eligible for $2,000 of disability, you go back to work, have your stained glass company, and it's now you're making $1,000 a month. That's a 50% loss in income. You'll receive 50% of your benefit. So that will go ahead and offset to get you back. If you're totally disabled, what happens? You're covered in normal retirement age. So this is a great policy. Excellent. All right, so we're going to talk about voluntary life insurance. So we know that you have a basic life insurance policy provided to you at no cost. If you want to provide additional coverage to yourself or your family, you can enroll in life insurance. Some of you have done this in the past. You don't need to do anything with your life insurance if you're happy. If you want to add to your life insurance this year, you may do so. You can add in $10,000 increments, as you can see on slide 16. You can elect up to 5 times your annual earnings, no more than that. Is anybody a new hire in the room? No one's in their new hire waiting period, so we cannot don't have to talk about the guarantee issue. That doesn't apply to anybody here. So you can buy 5 times your annual earnings. If this is your first time in, you're all veterans, according to your not being a new hires here. We have underwriting information for you, evidence of insurability. I have the rates for you. It's one of the best ways to buy insurance. I had a young lady come up to me in the first meeting in the room this morning and said, you know, I have a Farm Bureau policy. Let me see what this costs. And it was like a quarter of the cost a month for the life insurance. So you're buying as a group. You're buying with 300,000 other public employers, by the way, employees. So you're getting some really good rates here. So you buy it in $10,000 chunks. It is portable, so if you decide to go to another vocation, another job, you can take your life insurance with you. That's a very nice benefit. They're really close to the same. I mean, within pennies, okay? They have a portability table, but yeah, it's pretty much taken. Portable is portable, so yes, it's very close. Conversion, a lot of people stay away from that because it's so expensive, but you could convert it if you'd like to into a whole life policy if you leave the county. There is a coverage reduction just like the basic policy, right? So it does reduce at your ages if you reach 65 and 70, okay? You can buy life insurance for your spouse. In order for you to buy it on the spouse, you have to buy it on yourself. You cannot exceed, and this is on slide 17, you cannot exceed 50% of your amount. So if you buy $50,000 on yourself, what's the amount you can buy on your spouse? $25,000, right? So that's why you see it in increments of $5,000 versus $10,000. They want to make sure you're at least getting no more than 50% of your own election, okay? Nobody's eligible for guarantee issue. If you want to add your spouse this year, since you've had life insurance in the past, or you both want to come on for the first time, see me after the meeting. I've got all the table rates and I have the application forms. You do have to go through medical underwriting. I want to be clear on that, but you don't have to go through a medical exam. And that's the difference here too, because a lot of people will walk away from life insurance just because they don't want to have, that exam. And I understand that. So it's a very simple way for you to get through the underwriting process, okay? You can buy it on your children. It's very inexpensive. It's $160 for $5,000 of benefit. Whether you have 5 children or 1 child, it's $160. If you buy it for, that's for $10,000, excuse me. So it's going to be 80 cents for $5,000, okay? So 5 children, it's going to be $160 a month at $10,000 or 80 cents for 5 children or 1 child. It doesn't matter. It's a unit price. Please keep in mind you cannot exceed 50% of your offering. So if you purchased $10,000, you could only get $5,000. So I put the note on that, slide 17 there at the bottom. And you must buy it on yourself in order to get it for your children. Children are always guarantee issued. Children are always guaranteed issues, so if you want to add your children on, they don't have to fill out any applications for that. Okay? As a reminder, your pre-tax benefits are automatic for your health insurance, your dental insurance, and if you elect that vision plan this year, it's also going to be pre-tax unless you state otherwise. Keep in mind, when you pre-tax your premiums, does anyone know what that means? What happens when you pre-tax? You don't pay Social Security, federal, state taxes on the amounts of your insurance. You are giving yourself a guaranteed 30% discount. So when I show you the rates here coming up here in the next couple slides, I want to remind you that those are retail numbers. So to get the number that applies to you, take that number, whether it's a single or family, times 0.7. Okay? You're giving yourself a discount. Page 19. CompPsych is the EAP, Employee Assistance Program, second to none. Life is difficult. I don't know about you, but it's kind of been stressful lately, right? Sometimes it's good to talk to people. You have access to counselors, it's private. You have a child at home who's going through some problems, you know. I just dealt with a friend that had a child that was not doing so well going to college, and they had to sit down and talk to some folks. You lose a loved one. You got financial stress. Got financial counselors. You can actually go online and do an online will for no charge. 75% of Americans don't have wills. This is a great site for you, okay? And it's not just for the people that are having a hard time. It's good to have financial advice. You lose a loved one. I mean, that's chaos. Where do I go? Which funeral home do I call? So there's concierges out there that can help you with these things. So just a reminder, it's confidential and it's free, and it's been in place for several years. Okay? All right, so monthly premiums. Let's talk about that, slide 20. Life, accidental death and dismemberment, long-term disability provided to you, no cost. Your medical and prescription premiums are definitely subsidized by the county, as you're about to find out. Your dental premiums are also subsidized if you're in the secondary roads, union, non-union, county assessor's department. Deputies and jailers, clerical unions are 100% employee paid for the dental. Voluntary vision, everybody would have to pay for that out of their pocket if they want it. It's not a requirement that you buy it, obviously. And the same thing for the voluntary employee dependent life insurance. Okay? Your portion of the medical and prescription drugs, your dental and your vision are pre-tax, as I mentioned. You save 30%. So let's get into the brass tacks, folks. Go to page 21, and let's start talking about the numbers. So beginning on or after July 1 of 2017, your rates for single insurance for the health is $588. If you have one, whether that's a spouse or a child, it's $44.62, and a full family that would be three or more is $70.86. Just to give you a little bit of a background, I do this for a living. The average across this country for union groups, not just all groups, is about $109 a month for single coverage on average. So your colleagues' cohorts are paying about $109 for single. Family is $313. So you got a heck of a deal here. You can see what the county is putting in for their share for your costs, and then you can see what the total premium, what we call a premium equivalent. Okay? Believe it or not, those are good rates. I know you're probably saying, wow, but those are good rates compared to what we see. And you couldn't find this coverage on the street, like I said. And it goes back to what I said earlier. A family of four in this country is paying about $24,000 for health insurance. When you scrape away the premiums and your out-of-pocket exposure and you put them all in one bucket for the number, you're going to come up with $24,000. And so you're at the average for cost, but well below for what your contributions are. And let me be clear, you guys deserve it. You guys have been rock stars on your wellness, and I want you to keep that up because obviously that's making a difference for you. It's unprecedented that I'm having a conversation say we're lowering your premiums. Do you folks know anybody that's just working for their health insurance right now? No, a lot of people. It's just incredible. Your dental costs are going up very slightly. We did enhance your plan. You got the carryover benefit, right? So I put those numbers in there as well, and I've broken those down depending on which department you're in. So I think you guys can read on those as well. They went up very slightly, like I said. And then we get to that vision plan, right? And those are the rates. We've broken those down the same way. So single employee plus one, whether it's a child or a spouse, and then we have the full family, three or more. So my question to you is if I want the single medical but the family vision, can I do that? Yes. If I want the family medical and 2-person dental and 1 person on the vision, can I do that? Yes. Okay. All right, so the next slide, 24, just some links, just reminders of things that you have available to you. You got tremendous resources available to you, okay? So what happens next? Let's make it simple. If you are happy with everything you have and you don't want to make any changes this year, you don't have to do anything except open up your mailbox in a couple of weeks because we're going to send you new Wellmark ID cards. Okay? For those of you that wish to add a child or delete a child or have a change in beneficiary on your life insurance, you want to make any changes on your medical, your dental, that's when we want to start talking to you. If you want to enroll on the vision plan, we'll need to have you fill out that paperwork, okay? So it depends on what you want. If you've moved, we'll need to hear from you as well, okay? So what I'm going to do is I'm going to go through your packets of information. All right. Let's start on the left-hand side. 2 forms, Delta Dental. Do you need to fill this out if you're not making any changes? No. The vision, I only need you to complete this if you want the vision. Otherwise, you don't need to do anything with this form. Okay? All the other forms I have up here, we can talk about that as well. Yep, it says Avisus at the top. That's the vision, Avisus Vision. Okay? On the right-hand side, I have a wellness preventive exam, just form for you in case you lost yours. And then the other items are I have a Delta Dental summary. I have the benefits to go. And I also have included your benefits for your vision, which is the Avisus. And then I have your summary benefits of coverage. Okay? Jane, I think I covered everything, did I not? Other than if you are making any changes, you don't have to do this today. If you are going to enroll in the vision plan, we're giving you all the way to June 16th to make that decision. Okay? So I need to have all the forms back by the 16th of June. Otherwise, that's all I had today. Anything else, Jane? Okay, so you're free to go unless you want to come up and see us. We have all the forms for any changes or the life insurance that I mentioned earlier. You can clap next year. No, it's fine. That's fine.